Hello and welcome to our talk today discussing GP and Healthcare Trust collaboration with the Gurkha Centre. Before BIM talks to you about the Gurkha Centre and how they can support your healthcare delivery, Blue, Holly, Sophie and I want to quickly introduce ourselves and our roles here. We're four fourth-year medical students at Imperial College who were placed on a community group placement here at the Gurkha Centre for 5 weeks now. Our aims with our placement has been to understand the role of the centre within its community and how it supports the health and well-being of its members and how it can potentially work with other entities like yourselves. We have come to appreciate the value of engagement between members and how BIM governs the organisation in an integrated manner. We have gotten to know BIM and those who work with him to achieve their mission, uphold their values, and how the centre is led. With each visit, we have looked at the processes of operation at the centre and how the centre has evolved from its genesis to what it is today, and what things can take the centre into further development and grow to reach more despite the challenges that they face, all which BIM will go into greater detail on later on in the talk. We aim to ethically evaluate and assess quality improvement with each visit, with further insights of the political and the financial environment of the centre. And now, at the end of our placement, we took all the information and insight we built to conduct our community health assessment and bring forth recommendations whilst working in collaboration with BIM to look at how to help further the reach of the organization in a manner that is respectful, professional, sensitive, and acknowledges the strengths and challenges which BIM and the organization face.
So during our time at the Gurkha Centre, we got to observe and get involved with many of the activities and services they provide, as well as getting to meet a really lovely community of people. We saw how dedicated and passionate the staff are and how they help people in the community with any problems they have, from things like passport applications to help with online banking or booking doctor's appointments. I remember one of the ladies we spoke to said, if we have a problem, we just go to the Gurkha Centre and they solve it. We also got to sit in on a couple of their brilliant English classes, which are so helpful and allow people for whom English isn't their first language just to pick up basic words and phrases that allow them more independence to do things like understand the buses or get around the supermarket, kind of simple things that we very much take for granted. It helps. These classes really help them to do. And my favourite day of the placement was when we got to join in with the Diwali celebrations. Just seeing how happy everyone was and what a lovely community atmosphere there was showed me that the Gurkha Centre is somewhere that people can go to get out of the house, socialise, speak to new people and just have fun. Everyone was up singing and dancing and it was just a lovely experience for all of us.
On our global health course, we've learned a lot about positionality. And I think as medical students in this massive organisation that is the NHS, we often don't see the people who fall through the cracks or those who have like the most barriers to accessing healthcare. And I think that also because we have like one of the most universal healthcare systems in the world, we can sometimes like feel a bit arrogant and think, oh, it's impossible for people to fall through the cracks. But reflecting on our time at the Gurkha Centre, I think we've all realised how important small charities are in providing absolutely essential services to people in the community, and also like the many challenges that these organisations face to provide these essential services. I think overall, every time we've gone to the Gurkha Centre, I just feel continuously inspired by Bim and his team, who leads the Gurkha Centre. Despite all the challenges and red tape, they are determined to make a difference, even when there's no funding and even when there's so little external support. Their determination and belief in the power of kindness is so motivating. So thank you, Bim, for all your hard work. You've definitely inspired us to not just stand by when we see injustices, but to do something about it.
Spending time with community organisations such as the Gurkha Centre during medical school is so important for shaping which kind of doctors we become in the future. During our global health course so far, we've learnt about the social determinants of health and some of the barriers that certain people face in accessing healthcare. Time spent with the Gurkha Centre has really put this learning into reality and has made us recognise the pertinent role that local organisations play in breaking down these barriers and supporting the health of the public before they've even accessed official healthcare. The issue of accessing healthcare due to language barriers is one of the main problems facing the Gurkha veterans and their families. We hope that when we are doctors in the future, we'll try our hardest to ensure that patients with English not as their first language have the necessary systems in place to ensure that they can understand what is being told to them during their consultations and be able to access booking systems like everyone else can so that they have control over their own health. If we decide to become GPs and work in primary care, we will promote the role of local organisations amongst our colleagues and to our patients as well, and will support any initiatives in place to improve access to certain groups. We hope to bring what we've learned and this appreciation of the complexities of delivering healthcare to a diverse population into our future careers as doctors, as well as knowing that the solutions lay in the role of community organisations such as the Gurkha Centre. We'd now like to pass on to the founder and CEO of the Gurkha Centre, Bim, who will introduce the organisation to you and tell you about the amazing work that they do.
Thank you, Holly, and everyone for the great presentation. So I will share my slides first. I've got a slide as well, just to double check if you can see the slides first.
Yes, we can.
So hello everyone. So my name is Bim Tamang. I'm the founder and CEO of the Gurkha Centre. Gurkha Centre is a charity established to support the Gurkha veterans and families. So I will give you a short presentation about what the Gurkha Centre does. The centre was established to bridge the service gap. And initially I started reaching out people in West London, including during COVID time. But now we have office space in Hayes, and we operate through our volunteers and staff. We've got part-time staff to provide support to our beneficiaries. And the service areas we offer or support people around health and well-being. This is being the predominant area of service we provide.